People living with HIV and AIDS have stormed the streets in Kenya, warning politicians not to interfere in the agreement that was signed between the Kenyan government and the United States of America. You see, politicians in Africa are so greedy, they are terribly greedy, egoistic, and very wicked to their own people. The US government and the Kenyan government signed a groundbreaking health deal. Under this deal, the US will continue what the USAID used to do, the United States Agency for International Development used to do. That is, they will provide money not longer to NGO but directly to Kenyan government to take care of people living with HIV, AIDS, tuberculosis, and fight some other diseases. That instead of giving the money to NGOs that they used to give before, they said that no, NGOs are corrupt and sometimes the money are not being used for the intended purpose. They decided that, okay, the money will be given out to government, to Kenyan government, to take care of people living with HIV and AIDS and their related diseases on what the USAID used to do. But the difference this time around is that it's given directly to the Kenyan government. Opposition parties, those who run NGOs, members of parliament who run NGOs, and those politicians who run NGOs from the opposition bench ceased to court. They went to court, asked the court to block the agreement. Their excuse is that Kenyan healthcare data will be shared with America. These same people are not worried that America is controlling Facebook, where majority of Kenyans who are on Facebook, their data is already in America. These same people are not worried that TikTok is using their data. These same people are not worried that X is using their data. In fact, most of the social media platforms being used, they are not worried that their data is being used. They are only worried that money that was supposed to be given to NGOs is given to Kenyan government. Now, what is the difference apart from the data is concerned? What's the difference? Because the difference is that they are not eating the money and they want that the money should enter their pocket. You see the wickedness of some politicians. So they will prefer people living with HIV and AIDS to go through challenges, tuberculosis, and some cancer-related diseases, to go through pain and possibly die because the money must pass through their own pocket so that they will cut a good amount of the money and provide peanut of treatment. Thank God that American government eyes has been opened. A lot of these foreign NGOs that operate, that they are organizing seminars or whatever, 60% of the fundings that American government or foreign funders gives end in their pockets. It ends in their pocket. I want you to watch this video to understand the context, wickedness of politicians.
To matters health now, people living with HIV in Kenya are criticizing parties that are moved to court to block the implementation of a landmark US-Kenya Health Cooperation Agreement covering HIV, AIDS, tuberculosis, malaria, maternal and child health, polio eradication, disease surveillance, and outbreak preparedness. The National Empowerment Network of People Living with HIV and AIDS in Kenya, NEPHAC, warns that halting the agreement could negatively impact those relying on government support to maintain their health and prevent new HIV infections. Among those seeking to stop the deal are the Consumer Federation of Kenya, COFEC, Busia Senator Okia Omtata, and the Law Society of Kenya, who argue that implementing the pact is unconstitutional and could expose Kenya health data to the United States. The current agreement channels resources directly to government institutions rather than NGOs.
If you go to court to block any form of American support, it means you are stopping a lifeline for people living with HIV, people who have TB, and other health conditions. America has been supporting Kenya for the last 22 years. In 2024, we mark 20 years of PEPFAR, and we have never had any issue of data breaches. And we hope that going forward, government to government support, there will be no breach in data. In terms of public participation, I started by saying that I'm not a government official, but I joined the bilateral negotiations to represent civil society and communities. So we are here in the judiciary to clarify to them that politicians and activists must not hide behind them to block support for people living with HIV.